For nipple care, before breastfeeding, place a warm compress or washcloth on your breast. So this could be, maybe you're just laying down and you have a warm washcloth on. Maybe you put a warm compress into your bra. My favorite ones are circular ones about this big. They're meant for kids. Owies, they can be put in the freezer to be cold or in the microwave to be warm. And they're great because you can just fit them right in your bra. They fit in really well. They're nice and flexible, not a super hard, stiff ice pack. And then once you're done breastfeeding, you can use them for your kids' owies. I'll link to one in the text. So warm compress on your breast before breastfeeding. So when your baby starts to stir, you could just throw that in. Let it sit in for a few minutes, 5 minutes, until it becomes room temperature. Anything in there is fine. Then hold your baby skin to skin. Holding your baby skin to skin will help them latch better. And if they're latching better, you'll have less nipple pain. So as much as you can, but especially with feedings, okay? So take all their clothes off, put them skin to skin, and use all your tips that you have to latch him deeply. After you're done breastfeeding, express a few drops of breast milk onto your nipples. Remember how it's full of antibodies and white blood cells, and it's going to heal any breakdown or cracks that you have on your nipple. So put some breast milk onto your nipples. It does, however, dry really quickly. And so you want a protective layer to protect against your bra or your clothing or baby's next latch. And so cover that up with a thick nipple cream. You could also use coconut oil. Coconut oil is an antiviral that's really great. But it's also very thin and it dries quickly. So I still like the thick nipple cream. And I'll link to a couple different nipple creams too. Most nipple creams you don't need to wash off, which is great because you want to rub on your nipples less, the least amount possible. And it's nice to have that very thin layer still on there. Most of it will have rubbed into your skin, but if there's a thin layer on there when baby goes to latch next, that will help from keeping that next latched so intense. So after you cover your nipples with a thick nipple cream, then put a cold compress on. So this could be from your freezer or from your refrigerator. It could be an ice pack like I talked about before, or it could be a Soothies Gel Pack that I'll link that also. The gel is supposed to help nipples heal well. Also avoid soap directly on your breasts or your nipples when you're in the shower or the bath because the soap will dry your skin out more. And then when baby goes to latch next, it's a little extra hair raising because your skin's so dry. The water alone can dry out your skin. And so I would recommend doing all of your nipple care techniques after the shower or bath. So express some breast milk, cover it up with a nipple cream, and you're good to go.